Dr. Ricate Ray Cubas, President and CEO and Academic Director, International Center for Advanced Review and Training, Inc. Congratulations. Dr. Ray is reshaping professional exams preparation for a global learner base. His visionary leadership blends technology, pedagogy, and innovation to make him high-quality, concept-driven learning accessible across borders. Dr. Ricate Ray Cubas, President and CEO and Academic Director, International Center for Advanced Review and Training. Congratulations!
The recognition of Dr. Ray Agapuz as the Pioneer Awardee for Asia's Emerging Leaders. This distinction celebrates a visionary educator and entrepreneur whose work has reshaped the landscape of nursing, review, and advanced learning systems across the region. As the founder of the Ray Agapuz Review System, Dr. Gopuz has empowered generations of nurses across 36 countries, consistently delivering top-notches, global passes, and an unmatched culture of academic excellence. His award is more than a personal milestone, it is a testament to the excellence, innovation, and global impact of the Ray Agapuz Review System, proving that world-class leadership can thrive in education just as powerfully as in the corporate arena. Tonight, we celebrate not only Asia's greatest companies, but also the leaders who inspire transformation, those who prove that excellence is not an act, but a legacy in the making.
Our speaker holds a higher education teaching certificate from the Derek Bach Center for Teaching and Learning at Harvard Graduate School of Education, where he also obtained a training certificate in online facilitation. He is a member of Harvard Business Review Advisory Council, an opt-in research community of business professionals. He finished a program on artificial intelligence from the University of Oxford. He finished his Master of Education in Learning, Design, and Technology and Post-Baccalaureate Certificate in E-Learning Design at the Pennsylvania State University, where he finished both courses with a GPA of 4.00. He completed his training on the ecosystem approach to designing and implementing outcomes-based education from the ASEAN University Network in Thailand. He finished his Bachelor of Science in Nursing cum laude and Master of Arts in Nursing summa cum laude at the University of Santo Tomas. He was a board top-notcher in the Philippine Nurse Licensure Examination, where he obtained a rating 89.20. He is a recipient of two doctorate degrees honoris causa from two state universities in the country, the Ramon Magsaysay Technological University and the Pangasinan State University. He co-authored a book on technology integration in teaching and learning entitled Collaborative Virtual Instructional Designs for Teaching and Learning Nursing. He is the author of NCLEX RN in a Flash published by Jones and Bartlett, USA, and Mosby's Essential Concepts for the Philippine Nurse Licensure Exam published by Mosby Elsevier. He is the proponent of the Functional Concepts Method, a teaching pedagogy for international licensure exams. He is the inventor of several game-based apps and a consultant of various international firms and educational institutions. He is a multi-awarded entrepreneur and author. Among his numerous awards are the Manny V. Pangilinan MVP Bossing Award for Education, the SMEIT Award for Innovation from the Philippine Internet Commerce Society, the AGRA Award for Entrepreneurship from the Philippine Marketing Association, the 10 Outstanding Filipino Entrepreneurs Entrepreneur 10 from Entrepreneur Magazine, and the Young Market Master for Entrepreneurship from Mansmith and Fielders. He is also the first Filipino nurse entrepreneur to be accepted as part of the Ernst & Young Entrepreneur of the Year Academy. In 2005, he was named one of Go Negocio's first 50 inspiring Filipino entrepreneurs, and in 2006, the Philippine Graphics magazine's Young Leaders of the Philippines. Also in 2006, he was co-listed with Bill Gates in the 25th edition of Marquis Who's Who in the World. Currently, he serves as a trustee of the Philippine Center for Entrepreneurship PCE, an advocacy group under the Office of the President. Ladies and gentlemen, Dr. Ray Agapuz.
Well, good evening, fellow learners and USRNs to be, and those who are joining us for the first time. Welcome, welcome, and welcome to our study group. And this group is really meant to enhance your knowledge, particularly on things that you're not so familiar with. Can anyone actually confirm if you have gone across any literature about tularemia or tularensis in the past? Kindly type yes if you have gone through some literatures about this, and no if it's the first time of you hearing about tularemia and tularensis. May I see? Come on. Log your answers on our chat box, please. Oh, a lot of you are saying no. So in other words, your ears are virgin when it comes to this topic. Yes? Yes, your ears are virgin. Okay, now since your ears are virgin about this topic, may I tell you that I will be giving out copies of my slides in handouts form. So if you may want to, please do have a copy of it. Just scan the QR code at the end of our discussion today. I'd like you to be I'd like this presentation to be interactive. I'd like you to interact with me, and I'd like everyone in this study group to make the most out of this discussion class, okay? So I'm joining you from the summer capital of the Philippines, Baguio City here at the basement one of our summer home. Anyway, where are you in the Philippines or in the world? So I'm joining you from Baguio. Where are you? Kindly type your location in our chat box, please. Naga City, oh my God, Cavite. Okay, Las Piñas, Bacoor, Kenya. Okay, hindi sa akin. So Kenya, Riyadh, Benguet, Bicol, Dipolog, Jeddah. In Ilocano, Jeddaga. Okay, where else? Let me see. Okay, Ilocos Norte, labas daw ng Munti. O anyone from Mandaluyong sa loob naman? Iloilo, well, I have a lot of friends in Iloilo. Of course, someone from Baguio is also joining us. Naimbag na Rabio Amin Apo, Riyadh, Kingdom of Saudi Arabia, Abu Dhabi, Bicol. Now, those of you may want to join us, please do tell your friends all the things that we are covering in this group study or study group. These are all trending topics. And take note, please do visit our YouTube channel after our presentation, and you will need to go to the videos. I'm going to upload the latest trend, and that's going to be in a 1-hour video. Okay, latest NCLEX trends. Okay, and that's going to be in a 1-hour video. I'm going to upload that after the discussion. So the discussion is different from the ones that I'm going to upload after. Okay? So somebody's also joining us from Biambang, from Mexico. I bet Mexico, Pampanga yan. Wag mo ako niloloko. Okay? Hindi yan Mexico. Mexico, Pampanga. Okay? Janice, yes? Am I right, Janice? Okay, I know you. Okay? You're joining us from Mexico, Pampanga. Okay, anyway, without further ado, I am your mentor for this group study scheduled today. And if you may want to check on your time, it's now 6:38 in the evening. And welcome to our next generation NCLEX Quick Fix group study. And my dogs are joining me. Choco is right beside me. And she's also saying yes to what we're doing. So let's talk about tularemia. Okay. Now, any entries that I would be writing down will definitely be entered into our chat group. Okay, let me just keep these guys a little side. Okay, so here we go. Now, take note. Have you ever heard about Lyme disease? Kindly answer me, yes or no? just to jumpstart our discussion so that at least you have an overview. Yes, you've heard about Lyme disease. Excellent. Yes, okay, excellent. So when we speak of Lyme disease, this is actually caused by Borrelia burgdorferi, and that is transmitted through your deer ticks. Okay, now let me tell you, tularemia, on the other hand, is transmitted by either your dog or your wood ticks. Okay? Okay. So what is the causative agent of Lyme disease? Borrelia burgdorferi. The causative agent of tularemia is either Dermacentor andersoni or Dermacentor variabilis. You don't have to write those down. Those things are very trivial. They're not being asked in the test. I bet I know NCLEX more than anyone in this world. I've been monitoring. I'm the only one in the world who's monitoring NCLEX in terms of its content. Way back from 1994, when I started as an NCLEX RN coach up to the present, look for someone else in the world. You're not going to find anything. So when I say so, that you don't have to write it down, don't write it down, because it's not going to give you any advantage writing down a lot of things. The most important thing that you have to do now is to listen and engage in discussions. Therefore, what I'd like you to think of is the fact that if the patient has been exposed to deer ticks, then you think of Lyme disease. If the patient is exposed to wood ticks or dog ticks, then think of tularemia. Now, in both conditions, there's no human-to-human transmission, which means it could only be transmitted by the modes of transmission that we've talked about, except that tularemia can also be transmitted by deer flies. Okay? So don't get confused. If it is deer ticks, then that's Lyme disease. If it is deer flies, then chances are that's tularemia. Okay? So tularemia could also be transmitted by handling of wild animals, specifically their meat. And one example would be those who are fond of this, eating rabbit meats. Well, I know for a fact that rabbits are very floppy pets, but however, in some countries in Europe, they serve rabbit meat in restaurants. I haven't tried eating a dish made of rabbit meat, but that could potentially be, especially those who are skinning rabbits, be a risk factor for developing tularemia. Okay? So way to go. Any question before we proceed? Because the next thing that I'm going to flash will be a sample case study. Okay? Are you learning so far? Tell me yes or no. Getting some good insights? Yes, excellent. Okay, so let's move on. So here's a case scenario. Now remember, on the next generation NCLEX, in which they're going to introduce some more innovations by April 1st of this year. So those of you who want to pass the test and you're rushing to pass the test, we're just about to complete our boot camp here in Baguio City. We're going to have the next boot camp in April. So remember, it's only the RayGapo system that has the AI-powered or AI-enabled NCLEX simulator, which you can use for free in our class. Okay, so let's have an example this time. A 34-year-old male is brought to the emergency department with acute fever, okay, 39.4 degrees centigrade or 103 degrees Fahrenheit, chills, fatigue, and a painful ulcer on his right hand. I'd like you to focus on the word painful because that would give you a clue. He reports that symptoms started 3 days after skinning a wild rabbit. I talked to you about this early on during a hunting trip. On assessment, the nurse notes enlarged tender axillary lymph nodes, headache, and myalgia. So if you would notice, what you have in the case are actually risk factors presented in the demographical data as well as the manifestations being presented by the patient on admission and the assessment findings. And then you have lung sounds are clear, no cough is present. That is also an important data to note. There's no cough, okay? So the vital signs, you have blood pressure, seems to me it's normal. The heart rate a little elevated, respiratory rate is normal, temperature is definitely elevated. And of course, your oxygen saturation in room air is at 98%, no problem with that. Now, when you are given a case like this, you have to utilize the strategy that's very unique to the Regapo system. I'm not afraid to share it because it's trademarked with the Regapo system. It's called the think first strategy. When you say think first, first is actually an acrostic, or it's an acronym. Okay? So F stands for the facts. Okay? If you're going to take a look at the facts, you have here 34-year-old with fever, painful ulcer on his right hand, and with a history of skinning a wild rabbit. Those are the most important data that you have to pay particular attention to. Then after that, you will have to integrate. When you integrate, you ask yourself, what system or what organ of the body is affected? Primarily, you have here an infectious condition because of the fever. So chances are, it could be the immune system that is affected. So your initial inference is that there's an infection. Okay? Next, R, what do? Reconnect. When you say we reconnect, we bring together the data plus your inference on which body system or organ that is affected. So in this case, what are we thinking of? We're thinking of a potentially infectious condition, okay? Because you have fever, okay? And it could have initially affected because you have an ulceration, the integumentary system or the skin, okay? So you have infection on the skin, okay? Then after that, S means syndromize. This is very unique to the Regapo system. Think syndromic. What does that mean? You need to cluster the data. In this case, which data are important? First, you have fever, and then you have a painful ulcer. Okay? And then, pay particular attention to this, you have lymphadenopathy, enlarged lymph nodes. Okay? And of course, no cough. Okay? And the most significant data of them all, this is after exposure to a wild rabbit. Okay, so that's how you should cluster your data. You syndromize, think syndromically. Then after that, T means think and choose. What does that mean? You go over the options now and try to do the process of elimination. Make sure when you eliminate, you don't eliminate the correct answer. Here we go. First, anthrax. Okay. Although, pay particular attention, in anthrax, you have a skin ulcer that is necrotic or black. Okay. There is no pain. Okay, so we need to eliminate option 1, anthrax. Then we go to Lyme's disease. What did we say a while back? Number 4, when you speak of Lyme disease, there should have been exposure to deer ticks. We didn't have that here. So we eliminate option 4. We're left with tularemia and plague. Now, plague or bubonic plague is usually manifested by, take note, necrotic tissues called buboes. Okay. And usually these are found on the distal part of the nose, the ear. So giving the patient a zombie-like appearance. Okay. We don't have it here. What we have are the following. Okay. Remember, fever, painful ulcer, lymphadenopathy without cough, and exposure to wild rabbits. And that gives us the answer, most possible correct answer, tularemia. Now, what did I just teach you? I taught you the framework for understanding a case scenario. So that's what's important in dealing with the next generation NCLEX RN test. You cannot answer questions by memorizing facts. In other words, the next gen NCLEX is not about facking. It's about understanding what the facts are telling you. Class, do you know this kind of thinking process until you attended this class today? Tell me, yes or no? Did you ever have an opportunity to get to know that there's a framework for analyzing? You see, that's what I'm trying to point out. So don't ever sit for the NCLEX without developing the think first syndromic thinking mindset or mindset. That's what's most important when you're preparing for the NCLEX. It's not about reading a lot of books. It's not about listening to a lot of false prophets on YouTube and on social media. Some of them have not even passed the NGN and they're bragging about teaching people how to pass the NCLEX. Excuse me. Okay? So you have to be very careful that you only learn from people who have had the experience of developing mental frameworks to help you answer questions the proper way. Okay? So did we agree on the correct answer? Do you agree with me that it's number 2, tularemia, based on the think first strategy? Come on, tell me, yes or no? Okay, yes, excellent. So let's move on. So this is now the functional concept. Remember, a functional concept could be a word, a sentence, a phrase. It could be even an entire paragraph that gives you a sense of direction on the proper thinking process that you need in order for you to deconstruct the questions properly and answer the question correctly and with confidence. So if you have exposure to rabbit with painful skin ulcer, lymphadenopathy plus fever, think tularemia caused by Francisella tularensis. Okay? Okay. So pag nakita mo na yan, rabbit, ulcer, lymphadenopathy or lymph nodes enlargement plus fever, think tularemia. Okay? If you see deer ticks, think Lyme disease. Deer flies, think tularemia. Okay? Okay. So far, so good? Let's move on. So, how do humans get tularemia? They can get infected by ingestion of or contact with contaminated water, food, or soil, or through inhalation of aerosols, even handling infected animal tissues, fluids, and bites of ticks. Now, what type of ticks? As I've been saying, okay, this is primarily due to wood ticks, Dermacentor variabilis or Dermacentor andersoni, and that's a contrast to the deer ticks that cause Lyme disease. Okay, now Lyme disease got its name because the deers that got infected with these ticks were initially isolated in Lyme, Connecticut. That's why it got its name from the place in Connecticut. It's called Lyme, Connecticut. So you have Lyme disease. Okay. Now, pay particular attention to the fact that the type of tick would tell you what disease is the patient suffering from. So if the patient has been bitten by a wood tick, chances are that's going to be tularemia or tularensis. If the patient has been bitten by deer ticks, by a deer tick, then that could be Lyme disease. Okay. Now, there's another confusion that we're trying to clarify early on. If it's going to be deer flies, that's still tularemia. Okay. So, deer ticks, Lyme disease, deer fly, tularemia, wood ticks, tularemia. Are you getting cleared on it so far? Yes or no? Let me know, please. Through our chat box. Yes? Clear so far? Excellent. So let's move on. Now, tularemia can be transmitted by, take note the ticks, dog ticks, wood ticks, and lone star tick or deer fly bite in contact with infected animals. Now, how does a lone star tick look like? Okay. Now, in Tagalog, we say it's like pulgas with a single dot at the back. So you see your ticks, these are like small crabs, okay, and they have shells, and there's a single white dot at the back, so it's called the lone star tick, okay? Now, this could also be transferred through dog ticks. Okay, now let's move on. There's no human-to-human transmission of tularemia. Therefore, if there's no human-to-human transmission, if you'll be asked on the test, what type of isolation precautions do you need to implement? Okay, there's only one answer, standard. Why? Because there's no human-to-human transmission. So you just have to make sure that you are safe. Protect yourself as a healthcare provider. So in which case, just have to implement standard precautions. Just like the Lyme disease, there's no human-to-human transmission. Okay, now, therefore, here's the issue. What happens if tularemia now becomes a part of bioterrorism? Okay, that's an entirely different story. Because tularemia is easily transmitted, it is classified as category A. Okay, which means, okay, if there's a form of tularemia that is created in the form of an aerosol that's easily transmitted, then that's a form of bioterrorism. And any form of bioterrorism, for that matter, must be reported. Okay? Immediately. So that's a priority intervention. Okay? Let's move forward. All forms of tularemia can be treated with gentamicin, not your broad-spectrum antibiotic. Your amoxicillin will not work. Your antiviral agents or antifungal agents will not work. It's only your aminoglycosides. Okay? And when you speak of aminoglycosides, you talk about those drugs that usually end in -ine. Okay? So gentamicin, streptomycin, and pay particular attention to the fact that these drugs that are ending in -ine would usually cause these adverse effects. First, nephrotoxic. What does that mean? If a drug is nephrotoxic, pay particular attention to the fact that it could potentially lead to acute kidney injury. Okay, and when there's acute kidney injury, there is oliguria. The second is it could also cause ototoxicity, and in which case it can affect cranial nerve 8 and the patient will experience tinnitus. Okay, those are the adverse effects. Now, what could be the implication? Now, before you administer gentamicin, you have to check on the kidney function of the patient. So take a look at the BUN, the creatinine. Pay particular attention to the symptoms being manifested by the patient. If the patient is having oliguria, that simply means that the kidneys are not working properly. And so there's a chance that when gentamicin or streptomycin is given, acute kidney injury may result. So in which case, the giving of the antibiotic defeats its very own purpose because your AKI develops, and what happens? So eventually, that could potentially lead to death. Okay? So remember gentamicin or streptomycin for 14 days. So far, so good? Let me know. You have questions? So far, are you doing great listening to our study group? Thank you so much. Clear so far? Clear naman. Okay, let's move on. Now, let's do this together. I want you to analyze this with me. If you cannot analyze, you oralize. So if you cannot analyze, you oralize. Here we go. Which assessment findings support the diagnosis of tularemia? Now, what I like with the next generation NCLEX is that you just have to relate some of these facts to what you've read on the case, and bingo, you can arrive at the correct combination of facts that are needed to support whatever inference in terms of your answer is concerned. Okay, so here we go. Painful skin ulcer at the site of exposure. From our discussion, is it a yes or a no for number one? I'd like you to discuss this with me. It's a yes, okay. Excellent, they're listening. Tender regional lymphadenopathy, is it a yes or a no? It's a yes, excellent. Productive cough with hemoptysis, it's a no. Wow. Sudden onset of high fever, did we have that in the case? We had that in the case, excellent. History of handling wild animals like skinning wild rabbits, excellent. Now, did we ever talk about vesicular rush on the trunk? Vesicular rush on the trunk is primarily associated with your varicella or chickenpox. So it's a no. Therefore, log your answers. Which numbers will comprise your answer to this question? Let me see. Come on. Log your answer. Log your answers. 1, 2, 4, and 5. And the correct answers are, you did well. Round of applause. Look, is the think first strategy able to narrow down the facts that you need to remember for you to answer this question correctly? Yes or no? Tell me. Yes. That's the key if you want to become a USRN. Remember now, nurses in America, I have a student who was just there like 3 years back, and now he is earning $250 an hour as a travel nurse. You see? You won't earn that much money per hour here. We have to be pragmatic. We have to be practical. We've worked so hard to become nurses, and so we want to serve the world. But we also want to be compensated because we have our own families, okay, who are dreaming of a better or the best life they can live because they sent us to school. I understand you. That's the reason why we're doing this study group, because we want as many Filipino nurses to pass the next generation NCLEX. And so far, is it serving that purpose? Let me ask you, are we? Yes. Dun po tayo sa pera. That's being pragmatic. I like that, Alvix. Okay? That's very good. That should be your motivation. Let's be practical. Okay? Ano ba? Okay? Okay. So let's move on. Kidding aside. Now, there are 3 types of tularemia. It could be pneumonic, ulceroglandular, and typhoidal. So, the most common is your ulceroglandular. Now, your ulceroglandular is usually manifested by skin lesions. Okay? So, in other words, the patient has an open wound. Okay? And the patient would usually have lymphadenopathy. Okay, that's the most common. The most fatal, though, is pneumonic. Okay, in pneumonic tularemia, the airways are affected, so the client's breathing should be the priority. And of course, typhoidal tularemia affects the gastrointestinal tract. The patient will usually have gastrointestinal symptoms like nausea, vomiting, okay, including the potential to develop disseminated intravascular coagulation and sepsis. Okay, those are the common complications of typhoidal tularemia. Okay, let's move further. What are the different manifestations? Once again, pneumonic tularemia, inflammation and bleeding of the airways, ulceroglandular lesions on the skin and mucous membranes. I've been saying a while back. Typhoidal tularemia, you have lymphadenopathy and GI symptoms. Now, having that in mind, let's answer this question. What is the priority nursing action? Now, remember the concept of prioritizing is always integrated into the case studies being presented in the actual test. Now, you always, if you have this question, if the question is asking about priority, you always think of the nursing process. That should be your framework, okay? You always think of, the nursing process. Okay, sorry for that. Okay, think of the nursing process. And when we speak of the nursing process, you always begin with assessment. And when we speak of assessment, you begin with obtaining blood cultures before antibiotics because you need the blood specimen to confirm the diagnosis. Remember, you don't need to place the client on airborne isolation precautions. You don't need to just give antipyretics because that won't work. You need your antibiotics, specifically your aminoglycosides, and you just don't need to administer oral fluids. In fact, it's one of the priorities. However, it's not the most significant because you're dealing with infection. So the answer to this question is to obtain blood cultures before antibiotics. Learning so far, let me know. Yes or no? Yes. Okay, great. Let's move on. Now, I'd like you to answer this question for me. Which medication is the drug of choice for severe tularemia? Amoxicillin, streptomycin, acyclovir, fluconazole. Okay, fluconazole is antifungal, acyclovir is antiviral, amoxicillin is broad-spectrum antibiotics. You're learning. Excellent. So streptomycin. And if your patient's taking streptomycin, what do we need to check? We need to check the kidney function test because it has the potential to become nephrotoxic. We need to check the functioning of cranial nerve 8. So the answer to this question is definitely streptomycin. So far, how many out of 4 questions did you answer correctly? I want you to be honest. Type 4 out of 4 if you did so. Excellent. I want you to be honest, and you're doing great. And look, you were just listening to what we're talking about for a couple of minutes, and there you go. You are getting a perfect score. How is that? That's the beauty of having the right mindset and the right framework on how to study for the next generation NCLEX. You see, these topics are out of this world. When you're just studying BSN in school, sometimes they don't even mention about these things. Because if you don't know the test content of the next generation NCLEX, it's entirely different from the NLE. It's not the same as what we have in the NLE. So stop thinking that if you pass NLE, you're going to pass NCLEX. Of course not. There were more than 200,000 Filipinos who took NCLEX in the last 3 years. And a measly 37% of them passed. Why? Mamaru. They're very pretentious. They were thinking they can do it because they passed that local licensure. Of course not. You have a different context when you talk about NLE and when you talk about next gen NCLEX. And come April of 2026, they're going to adopt the new framework again for the next gen NCLEX. And I don't know, okay, if others in the world have adjusted. We are constantly adjusting our instructional design to accommodate changes and innovations that they have been introducing on the NCLEX. Okay, so let's have question number 5. Which statements are appropriate regarding tularemia? So when you see the question appropriate, you know, a lot of people, okay, when they see select all that apply questions, kinakabahan sila. They get anxious. Stop being anxious. Think about select all that apply items as clustered true or false. So when you have this kind of question like this, okay, the fact that which statements, this implies that this is a select all that apply question. So there's more than one answer. All you have to do is to ask yourself, is this true? Is it false? If it is true, then include it in your final answer. It is a reportable disease. Is it true? Yes or no? Come on, log your answer. Is number 1 true? Yes. Okay, we talk about that. Standard precautions are usually sufficient. Is it a yes or a no? Standard precautions. It's a yes. It can be transmitted from person to person. Is it a yes or a no? It's a no. It is considered a potential bioterrorism agent. Is it a yes or a no? It's a yes. Tick bites are a common mode of transmission. They did not specify whether these ticks are wood ticks or dog ticks or deer ticks. If you just have that statement or label tick bites, then you can consider that as a general encompassing term that is all inclusive of the different types of ticks. Therefore, shall we include number 5? Yes. So log your answers now. Come on. On our chat box, it's going to be 1, 2, 4, and 5. Excellent. You see? You are just listening and engaging in our study group. And look at you guys. You are now at an advantage. You know why? Because you know something that a lot of people out there who are hoping to pass the NGN, they don't know. They don't know about these things. So if you know something that they don't know, you are at an advantage. And you are just engaging. So if I were you, you tell a friend, especially if they're preparing for the next gen NCLEX, to please do watch our videos on our YouTube channel. Because most of those videos are created based on the current trends on the next gen NCLEX. Okay? So let's move on. Here we go. So the answers are 1, 2, 4, and 5. Excellent. So let's move on to question number 6. If untreated, Which complication is the client most at risk for? Is it chronic kidney disease, sepsis, myocardial infarction, or pulmonary embolism? If you've listened to me, you'll be able to answer this correctly and give me an answer now. Go. Come on. They all got mixed up, okay? Because they were thinking about the chronic kidney disease. You were able to just remember the data based on your aminoglycosides. Somebody just typed 3. Did we talk about myocardial infarction early on? We didn't. What did I tell you? Your tularemia can potentially lead to disseminated intravascular coagulation or sepsis. Okay. When you have an infection, always think of septic shock as the most fatal or the most severe complication that the client is most at risk for. Now, so instead of getting 6 out of 6, you just got 5 out of 6. Anyway, there's always a room for improvement, and that's what matters. Let me ask you now, did you learn from what we're discussing in this study group session at this point? Tell me, yes or no. Did you learn? Yes. Now, my next question is, do you have any specific question about tularemia? Ask me now. Questions about tularemia? Okay. There's none? Questions so far? Come on, ask me. Okay. No questions? Are you sure? Questions so far? Aren't you going to ask me, is this the kind of questions that you will see on the actual next generation NCLEX? Of course. This is a case study followed by 6 different types of questions, and that's how questions are presented on next gen NCLEX. Okay? Is this study group benefiting you? Tell me, yes or no? Okay. Do you want a copy of this presentation? So if you want a copy of this presentation, yes, please scan this QR code to get your free Reseta handout. Sir Ray, do you recommend taking March or April po? If you are ready, you can take by March. You can even take tomorrow if you wish. Okay, but if you are not yet ready, if you will want more drills, then by all means, there's no harm in postponing your test to at least several days or weeks or even months. If that would make you feel more prepared, go ahead. Okay. What else? Do you have any other questions apart from what we've talked about? Somebody here has a question. Okay. Do you have any question? Okay. So, private question. Do you do tutorials? Of course, we do tutorials, especially those who are rushing. We have a 3-day program. It's called the Quick Fix program. So it's with me for 3 days. It's a 24-hour NCLEX schedule in which all the things that you need to know about the test specific for that month is being discussed. Thank you po and see you Quick Fix on March. Iba na po ulit sir ang set sa April? Yes. Meaning bagong style na po? Of course. Oo, bagong style na siya. Kailan po ang next Quick Fix? We have a monthly Quick Fix. We have a Quick Fix for February, Quick Fix for March, and the rest of the year. So we are doing this monthly. Meron daw bukas uli. No, I'm in the bootcamp here in Baguio. So I will be doing the class here in Baguio for the bootcamp. Do we have a Quick Fix this January? We're done. The Quick Fix this January was done last January 5, 6, and 7. Okay. So the next Quick Fix is going to be February. Okay. Request po ng psych drugs, doc. Please love it. Okay. Please go through our YouTube channel. I have 2 videos on pharmacology focusing on drugs. Please just watch those videos. It's 1.5 hours. Okay? May schedule na ba for February? Yes, please call our office. Miss Joanne, our general manager, knows the schedule more than I do. But what I know is that we always have it on the first week of each month. So for February, we definitely have a Quick Fix session. Okay. So what else would you want to ask? Okay. Thank you. You're most welcome. Okay. Look for Miss Joanne or Miss Arlene. Miss Joanne is our general manager. Okay. she knows the schedules for the quick fix and the boot camp. The difference, the boot camp is a high yield, okay, high intensity class, okay, that begins from morning to evening. It's a 10-day camp, and it's being done here in Baguio, okay. Usually the participants stay in a hotel, okay. So the quick fix is a 3-day program, total of 24 hours with me, okay, as the mentor. And that includes the use of our simulator and, of course, our very famous receta, okay? So for those of you who may want the handouts, please do scan the QR code, okay, to make sure that you will receive your handout. So do you have any other questions in terms of the content of our discussion today? Okay, we have another one. Ano pong date ilalagay sa NCLEX date sa mga hindi pa po graduate? Okay, you just place there 2026. Okay, thank you. Okay. Any other questions so far? Okay, let me run this survey. Was our session helpful? Tell me. Yes or no? It is. Okay. Okay. So if you have any request on which topic that you want any of your mentors from the Ray Gapo system to cover anytime in the future, big yes. Thank you po. Okay. Just don't hesitate to let us know through the QR code, and we'll be glad to cover it in your future group study. So without further ado, we're now closing our discussion. It was a great session learning with all of you, and this is on the topic Tularensis and tularemia. This is your mentor, Ray Gapo, saying thank you, a pleasant evening, and God bless you. I'll see you back again next month for another session. Next week, it's going to be with Mentor McLean, and she'll be highlighting, don't miss it, because cranial nerve assessment is trending for the month of January 2026 on the NGN. And Mentor McLean will just highlight the most important aspects of cranial nerve assessment. Thank you, God bless you, and a pleasant evening, everyone. Maraming salamat po. Bye-bye!